Understanding dementia. Symptoms, causes, and treatment options. Dementia is a condition that affects millions of people around the world. It is a progressive disease that affects memory, cognition, and behavior, and it can be devastating for both the individual and their loved ones. Understanding the symptoms, causes, and treatment options for dementia is crucial in order to provide proper care and support for those affected by the disease. In this post, we will explore the different types of dementia, the most common symptoms, and the risk factors associated with the disease. We will also delve into the current treatment options available, including medication, therapy, and lifestyle changes. By the end of this post, you will have a better understanding of this complex disease and how to support those affected by it. 1. Introduction to dementia. Dementia is not a specific disease, but rather a term used to describe a range of symptoms that affect brain function. It is a condition that affects millions of people worldwide, and its prevalence is predicted to increase in the coming years. Dementia primarily affects older adults, and the risk of developing this condition increases with age. However, it is important to note that dementia is not a normal part of aging. Symptoms of dementia can include memory loss, difficulty with language and communication, changes in mood and behavior, and a decline in cognitive abilities. This can have a significant impact on a person's daily life and ability to perform routine tasks. There are several different types of dementia, each with its own causes and treatment options. Alzheimer's disease is the most common form of dementia, accounting for around 60–80% of all cases. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. While there is currently no cure for dementia, there are treatment options available that can help manage symptoms and improve quality of life for those affected. These can include medications, lifestyle changes, and supportive therapies. It is important for individuals with dementia to receive a proper diagnosis and to work closely with their healthcare team to develop a personalized treatment plan. 2. Understanding dementia. Symptoms and types. Dementia is a term used to describe a wide range of mental health conditions that cause a decline in cognitive function. This can include memory loss, difficulty with language and communication, and changes in mood and behavior. There are several different types of dementia, with Alzheimer's disease being the most common. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. Symptoms of dementia can vary depending on the type and severity of the condition. Early signs can include forgetfulness, difficulty with problem solving or planning, confusion, and trouble with daily tasks such as driving or managing finances. As the condition progresses, symptoms can become more severe and may include personality changes, agitation, and hallucinations. It's important to understand that dementia is not a normal part of aging and that there are treatment options available. While there is no cure for dementia, medications and lifestyle modifications can help manage symptoms and slow the progression of the condition. It's also important to have a support system in place, both for the person with dementia and their caregivers. Understanding the symptoms and types of dementia is the first step in providing the best possible care for those affected by this condition. 3. Early signs of dementia. Dementia is a progressive disease that affects the brain, and it can be difficult to recognize the early signs of the condition. However, it is important to be aware of these signs, as early diagnosis can help in managing the symptoms and providing the necessary support to the person affected. One of the earliest signs of dementia is memory loss, where the person may have trouble remembering recent events or important dates. They may also forget familiar names, places, and objects. Other early signs include difficulty in performing familiar tasks such as cooking or driving, difficulty in communicating, misplacing things, forgetting the purpose of certain objects, and changes in mood or personality. It is important to note that these symptoms can be caused by a number of other factors such as stress, depression, medication, or other medical conditions. However, if these symptoms persist and begin to impact a person's daily life, it is important to seek medical advice. If you or a loved one is experiencing any of these symptoms, it is important to speak to a doctor or healthcare professional. Early diagnosis can help in managing the condition and providing the necessary support and care to maintain a good quality of life. Additionally, there are many treatment options available that can help manage the symptoms and improve the overall well-being of the person affected. 4. Common causes of dementia. Dementia is a progressive condition that affects the brain's cognitive functions, memory, and behavior. It can be caused by a number of factors, including age, genetics, lifestyle, and medical conditions. One of the most common causes of dementia is Alzheimer's disease, which accounts for about 60–80% of all dementia cases. This condition is characterized by a buildup of amyloid plaques and neurofibrillary tangles in the brain, which cause the death of brain cells and the loss of cognitive function. Vascular dementia, another common type of dementia, is caused by a series of small strokes that damage the brain's blood vessels and reduce its blood supply. This type of dementia is more common in people with high blood pressure, high cholesterol, and other vascular risk factors. Other causes of dementia include Lewy body dementia, frontotemporal dementia, Parkinson's disease, and Huntington's disease. These conditions are caused by abnormal proteins that accumulate in the brain and cause the death of brain cells, leading to cognitive decline. It's important to note that some causes of dementia are reversible and can be treated, such as vitamin deficiencies, thyroid problems, and medication side effects. However, many cases of dementia are irreversible and require ongoing care and support from healthcare professionals and loved ones. 5. Risk factors for dementia. Dementia is a complex condition that affects millions of people worldwide. While it can be difficult to predict who will develop dementia, there are certain risk factors that have been identified. Understanding these risk factors can help individuals take preventive measures and reduce their risk of developing dementia. Age is the most significant risk factor for developing dementia. As people age, their risk of developing dementia increases. It is estimated that around 1 in 6 people over the age of 80 have dementia. Other risk factors include genetics, lifestyle choices, and medical conditions. Having a family history of dementia increases the risk of developing the condition. People with a parent, sibling, or child with dementia are more likely to develop the condition themselves. However, it's important to note that not everyone with a family history of dementia will develop the condition. Lifestyle choices such as smoking, heavy alcohol consumption, and a poor diet can also increase the risk of developing dementia. High blood pressure, high cholesterol, and diabetes are also risk factors for developing the condition. It's important to maintain a healthy lifestyle to reduce the risk of developing dementia. In conclusion, while it can be difficult to predict who will develop dementia, understanding the risk factors can help individuals take preventive measures and reduce their risk of developing the condition. Maintaining a healthy lifestyle, managing medical conditions, and staying mentally and socially active are all important steps in reducing the risk of dementia. 6. Diagnosis of dementia. The diagnosis of dementia can be a difficult and lengthy process, often involving multiple doctors and specialists. It typically begins with a physical exam and cognitive tests to evaluate memory, thinking, and judgment. Doctors will also conduct a thorough medical history and review any medications the patient is taking. Blood tests, brain imaging scans, and neurological exams may also be ordered to rule out other possible causes of symptoms. In some cases, further tests may be needed to confirm a diagnosis of dementia. These may include a lumbar puncture, which involves taking a sample of spinal fluid to test for abnormal proteins associated with Alzheimer's disease and other forms of dementia. Brain biopsies are rarely performed but may be necessary in some cases to determine the type of dementia. It's important to note that a dementia diagnosis can be difficult to accept, both for the person with the disease and their loved ones. However, an accurate diagnosis can help with treatment and care planning, as well as providing access to support services and resources. If you or a loved one are experiencing symptoms of dementia, it's important to seek medical attention as soon as possible. 7. Treatment options for dementia. Dementia is a progressive disease, and while there is no cure for it, there are several treatment options that can help manage its symptoms and improve the quality of life of affected individuals. The treatment options for dementia vary depending on the stage of the disease and the individual's symptoms. Medications form an important part of dementia treatment. There are several medications available that can help manage symptoms such as memory loss, confusion, and mood swings. These medications work by increasing the levels of neurotransmitters in the brain, which are responsible for communication between brain cells. Behavioral therapies such as cognitive training, reality orientation, and reminiscence therapy can also be helpful in managing symptoms of dementia. These therapies aim to improve memory, communication, and social skills, and can help individuals with dementia maintain their independence for as long as possible. In addition to medication and behavioral therapies, lifestyle changes can also play a significant role in managing dementia symptoms. Exercise, a healthy diet, and social engagement can all help improve cognitive function and delay the progression of the disease. Caregivers can also provide support and assistance with daily tasks that can help maintain a sense of independence and enhance the quality of life of individuals with dementia. It's important to note that treatment options for dementia may need to be adjusted as the disease progresses, and it's crucial to work closely with healthcare professionals to ensure that the individual receives the best possible care. 8. Medication for dementia. Medication for dementia is a complex subject, as there is currently no cure for the condition. However, there are medications available that can help to manage some of the symptoms of dementia and improve the quality of life of those affected. One type of medication used to manage symptoms is cholinesterase inhibitors, which work by boosting the levels of acetylcholine in the brain. This is a chemical messenger that is important for memory and learning, and is often depleted in people with dementia. Memantine is another type of medication that is sometimes used to manage symptoms of dementia. This drug works by regulating the levels of glutamate in the brain, which is another chemical messenger involved in learning and memory. It's worth noting that different medications may be prescribed depending on the type of dementia a person has, and the severity of their symptoms. It's important to follow the guidance of a healthcare professional when it comes to medication for dementia, and to carefully monitor any potential side effects. In addition to medication, other treatments such as occupational therapy, speech and language therapy, and psychological support may also be recommended. 9. Lifestyle changes and prevention of dementia. While there is no cure for dementia, researchers believe that certain lifestyle changes and preventative measures can help reduce the risk of developing the disease. Here are some steps that you can take to help prevent dementia. 1. Exercise regularly. Regular physical activity can reduce the risk of developing dementia by up to 30%. Exercise helps improve blood flow to the brain, which can help keep brain cells healthy. 2. Eat a healthy diet. A healthy diet that is low in saturated fats and rich in fruits, vegetables, and whole grains can also help reduce the risk of developing dementia. Eating a diet that is high in omega-3 fatty acids, such as those found in fish, can also help improve brain health. 3. Stay mentally active. Keeping your mind active and engaged can also help keep your brain healthy. Activities like reading, doing puzzles, or learning a new skill can help keep your brain active and may help reduce the risk of developing dementia. 4. Manage chronic conditions. Keeping chronic conditions like diabetes, hypertension, and high cholesterol under control is also important, as these conditions can increase the risk of developing dementia. 5. Get enough sleep. Getting adequate sleep is crucial for brain health. Lack of sleep can cause cognitive problems and increase the risk of developing dementia. While these measures may not completely prevent dementia, they can help reduce the risk of developing the disease and improve overall brain health. It's important to remember that some risk factors for dementia, such as age and genetics, cannot be controlled. However, by making these lifestyle changes, we can take control of our health and potentially reduce the risk of developing dementia. 10. Support for caregivers and families of those with dementia. Caring for someone with dementia can be a difficult and overwhelming task for families and caregivers. It is important to remember that caregivers and family members need support too. They often face physical, emotional, and financial challenges, which can cause stress and burnout. Fortunately, there are many resources available to support caregivers and families of those with dementia. Support groups offer a safe space for caregivers and family members to share their experiences, feelings, and concerns with others who understand what they are going through. These groups may be offered through community centers, hospitals, or even online support groups. Respite care is another option that can provide temporary relief for caregivers. This can include hiring a professional caregiver or utilizing adult daycare services. This allows caregivers to take a break and recharge, which is important for their own physical and emotional well-being. Financial assistance programs may also be available to help with the cost of care. Medicaid may cover some of the expenses associated with dementia care, while other programs offer financial assistance. For caregivers who need to take time off work to care for their loved ones. Remember, caring for someone with dementia can be an emotional and challenging experience, but there is support available for caregivers and families. Seeking out these resources can help to reduce stress, prevent burnout, and provide a better quality of life for both the caregiver and the person with dementia. 11. The importance of early intervention. Early intervention is crucial when it comes to dementia. If the symptoms are detected early, proper treatment can be provided which can help slow down the progression of the disease. This makes it important to identify the early signs of dementia so that the person can receive the necessary care and support. Some early signs of dementia include memory loss, difficulty with language, confusion, and changes in mood or behavior. If you notice any of these symptoms in yourself or a loved one, it's important to schedule an appointment with a healthcare provider. A healthcare provider can perform an evaluation which may include cognitive tests, brain scans, and medical history reviews to determine the underlying cause of the symptoms. Once a diagnosis is made, the healthcare provider can provide the necessary treatment and support. Early intervention can also help with planning for the future. This allows the person with dementia and their loved ones to make decisions about care and support while the person is still able to participate in the decision-making process. This can include making legal and financial arrangements, as well as discussing care options such as in-home care or assisted living facilities. Overall, early intervention is critical for managing the symptoms of dementia and ensuring the highest possible quality of life for the person with dementia and their loved ones. 12. Conclusion and final thoughts. Dementia is a complex and devastating disease that affects millions of people worldwide. It can be caused by a variety of factors, including genetics, lifestyle, and environmental factors. Symptoms can vary from person to person, but often include memory loss, confusion, and difficulty with basic tasks. While there is currently no cure for dementia, there are treatment options available that can help manage symptoms and improve quality of life for both the patient and their caregivers. It's important for family members and caregivers to understand the nature of dementia and the challenges it presents. This includes learning how to communicate effectively with someone who has dementia, providing a safe and supportive environment, and finding ways to engage the patient in meaningful activities. One of the most important things to remember is that people with dementia are still individuals with unique personalities and experiences. They deserve to be treated with respect, dignity, and compassion, even as they struggle with this devastating disease. In conclusion, while dementia is a difficult and challenging condition, there are many resources available to help patients and their families cope with its impact. By taking a proactive approach, seeking out support, and staying informed about the latest research and treatment options, it's possible to provide a better quality of life for those affected by this disease. Together, we can work towards a future where dementia is no longer a source of fear and uncertainty, but a manageable condition that can be treated and overcome. We hope this article has provided you with a better understanding of dementia, its symptoms, causes, and treatment options. Dementia is a complex condition that affects millions of people worldwide, and it's essential to raise awareness of the illness and its impact. If you or someone you love is experiencing symptoms of dementia, it's vital to seek medical attention as soon as possible. Remember, the earlier the diagnosis, the better the treatment outcome. Let's continue to educate ourselves and others about dementia and work towards better support and care for those affected by this illness.